Hey friends, welcome back. Hope you guys are having a blessed day. For those of you who don't know us, we're with Total Health and Wellness. I'm Mark, I'm a certified health coach, and this is Teresa. She is a board certified family nurse practitioner, and we like to talk about hormones, metabolic health, and everything in between. Before we get started, I was going to just bring up the conversation you and I had at the gym at the end. We were getting done and we were doing abs and stuff. And I looked over at Teresa and I said, I didn't want to go to the gym today. I wasn't feeling like it this morning. I was kind of dragging. I didn't sleep great last night, so I was a little bit dragging today and tired. And then I just didn't feel like I wanted. And then I was telling myself in my mind on the ride to the gym, I was like, well, first of all, it's good that we both were going because if I had faltered a little bit, Teresa would have picked me up, and then vice versa.
Yeah.
So that's great having your little tribe or your people you're engaged with those activities, whether it's like eating the right way or exercising. But on the ride to the gym, I was thinking, I'm just going to go in and kind of take it easy. I'm not going to go in there and go like hardcore with the gym or whatever. So I ended up going there and I went up on all my weights. Like I had to reduce the amount of repetitions I did, but because I was doing the legitimate time under tension smart workout. And I told Teresa that I was like, you know what? I went up on every single one of my exercises today.
And what did I say?
You did too. You felt well.
You said me too.
You said you felt strong today.
Yeah.
So anyway, I guess the moral of the story is that even though you're feeling kind of bad and down and stuff like that, don't just discount things because you can 100% make some gains during those. Apparently, during those days when you're feeling bad.
Anyway. I didn't want to go, but I thought, oh gosh, I'm just going to go. Only be there for 20 minutes, and it was done.
Yeah. So and we were there for about 20 minutes, maybe 25, when including the going in and out and washing hands and stuff like that. And yeah, I'm glad we did.
Yeah.
So. All right, guys. Well, today we're going to talk to you guys a little bit about modern snake oil. So when I mention modern snake oil, I'm actually talking about pharmaceutical companies and drugs. We've seen time and time again that these companies and the drugs that they push are, they're not in your best interest. So, and they're not made to necessarily make you healthy. They're driven towards profits for those companies. And, we've seen this both through the revolving door between government agencies and the actual pharmaceutical companies. So politicians will move forward with legislation that's very positive for pharmaceutical companies, or they'll help pharmaceutical companies quash some competition or shut down something they're competing with. And then those politicians get, there's an open door policy for them to go and get a job when they get out of politics with these companies. That could just be going around speaking. Not knowing anything really about the companies or whatnot. And they get paid big money for doing that. We also see and Teresa's going to talk to this about this extensively, is the moving of the goalposts, with all of these different health concerns we have and issues. So I'll just go ahead and hand it over to you.
And I was just, so two things I was thinking. Number one is I just got an email a couple weeks ago about a pharmacy that I really like, but I don't use them, a compounding pharmacy. They're great, but I just don't use them. Just, how you're kind of started with one and you're loyal. Yeah. They're being sued by one of the pharmaceutical companies. I don't want to say the wrong one.
Yeah.
And I said to him when I read the email, and he's like, well, of course they are. They're competitors, and they have all the money and all the backing and all the clout. And so then the other thing I was thinking was, I know who made me. And if you follow us, you know that we love Jesus. But even if you think you came from an amoeba or a monkey and you just evolved, you have to think, if you came from an amoeba and now that's a pretty smart amoeba, or some sort of
smart programming.
Right. Yeah. So there can't be in there that the only way you can be healthy is with an injection or a pill. Like, it just can't.
And we've been totally fine without injections and without pills for a very, very long time. It's just been more recent.
And honestly, maybe not in the very beginning, because people didn't live past, sometimes even infancy.
Sure.
But we're talking that sanitation and some other things. We wear gloves now when we deliver babies. We didn't do that. And Dr. Simowitz, which was an OB, said we should wear gloves. And they told him he was a quack. And
they ran him out of the system. He ended up committing suicide.
Yeah, he ended up in an insane asylum.
Yeah, they ridiculed and just demeaned that doctor to the point, took away his license. I mean, it was a terrible story about the guy for saying, let's wash our hands in between delivering babies. They would literally go from one placenta in their hands to another placenta from another woman.
Or they would go from the morgue up to deliver a baby.
Yeah.
And, but anyway.
We digressed.
Yeah. So there's lots of this stuff going around. There's lots of smear campaigns going around.
For sure.
Nurses. I don't know about physicians because I'm not in those circles. but nursing
physicians,
boards.
there is a conflict of interest because in many cases, physicians are receiving compensation directly from pharmaceutical companies for the sale of their product. That includes vaccines, that includes statin drugs. There's a number of different products. That is, you can actually look at, what was the name of the website? You can look it up online. You can actually go online and see if a particular licensed medical provider has received any sort of kickbacks from pharmaceutical companies.
And oncology is the only,
cancer.
my gosh, medicine specialty.
Yes.
Oh my gosh, I slept fine. Is the only specialty that actually gets money for the chemo. They get a percentage of the chemotherapy that they give you. That's unheard of and absurd and a conflict of interest.
For sure.
Anyway, so back in the 40s for blood pressure, let's just talk about blood pressure first. The goal for blood pressure was 200 over 100. Okay, so that blood pressure reading would have been totally fine. Now, every decade or 20 years, they just slowly lowered it. And now, well, as of 2024, a normal blood pressure was 120 over 80, less than 120 over 80. So you're 125 over 92, you're going to get a blood pressure medicine. We've talked about this before. You're going to get a blood pressure medicine without a consent. So you're especially giving these men blood pressure pills that cause ED. Men love their penis, as they should. But if you told men, I'm giving you this blood pressure pill, but it could cause ED, they would say, no, thank you. But they don't get told that. And then the other big one, I mean, it's all of them, but these are the ones that we hear about all the time, is cholesterol. Back in the day, cholesterol of 400 or below, you would have been totally fine. No one's going to offer you some statin that destroys your mitochondria and destroys your mevalonic pathway and destroys or depletes CoQ10 and vitamin K that causes more calcification. Doesn't matter. 400 or less, you're fine. And then we all know it's slowly lowered. And 200 is now what it shows up on labs. But now there's talk with these lipidologists, talk of 100 or less. And they're talking LDL, I think it's 60 or less. So it's just, it's a lot.
Yeah, just remember, they rely on you being sick. And if you're not actually really sick, they can just move the goalposts and make it look like you're sick, and then they can sell their drugs. So that's what we're talking about right now.
And so sometimes people, if your doctor's writing you atorvastatin, which is Lipitor statin, they're not maybe sending that into the drug company. The drug company's not giving them a Longhorn gift card, but you have to reach certain metrics. And so for sure, for pediatrics, if a certain amount of your pediatric patients are vaccinated, you get huge bonuses for some of the insurance companies. There's not much room for the non-vaccinated. That's why your friends, or you hear people say, I got fired from my pediatrics, or people will say, I'm looking for a pediatric clinic, but they all want to make sure I'm going to be vaccinated. They will not take you because you're going to mess up their bonus. And, truth be told, pediatricians and GPs, they don't get paid that much. So they rely on these other things.
Yeah, for sure.
So God didn't, or your amoeba didn't make you to have a chickenpox vaccine deficiency.
Yeah.
Did your parents send you to a chickenpox party?
Not a party. I just had them. I forget where I got them, but I remember being, sick for a few days, having fevers and having the chickenpox. And, I was young. I was probably 10 years old when I got them, and it was just miserable. But you did it. You got it over with, and I forgot about it. I didn't remember.
I got it much younger than that, and I did have it really bad. But I remember my parents saying, oh, so-and-so has chickenpox. We're going to send you over there for a play date. And then in 10th grade, my best friend got chickenpox for the first time. And I was the only one that could still go over and chat with her. So I probably got a little bit of a booster. Booster shot.
I had forgotten all about chickenpox till you brought it up.
Well, because nobody freaked out about the measles and chickenpox when we were young. They just didn't.
Yeah.
So
it's interesting how it only takes a generation or two generations, not even, to completely detach ourselves from our history. So now it's just totally normal to have all this, because we talk about this all the time, all of these high sugar, high carbohydrate, processed plant-based foods, and they're all around us, and all they are energy. All of our food is completely devoid of nutrients, but full of sugar and full of fat and full of just empty calories that we're consuming. That's not normal. That's never been normal. But when we go to the grocery store and we see that crap everywhere, we think it's totally normal. And it's not. The outside perimeter of the grocery store is where it's kind of normal at again. Okay. And I get some of the meats and things like that, they have hormones and whatnot in it. That's not normal. But for the most part, that outside perimeter, the meats, the cheeses, some of the dairy products, the vegetables, some of the fruits and stuff like that. That's where we should be shopping, and that's what we should be eating, not in the checkout line where you have the Snickers bar and the smorgasbord of extra large, candy bars in front of your face, or king size. Yeah. Oh gosh.
Yeah. And in some of the groups that I'm in, they're talking about it's only been 2 generations of women now that have been on birth control. And like birth controls in all the fish and all the streams and lakes, they've done tests. But 2 generations of women that have just been nonstop on hormonal birth control now have infertility issues, cysts, endometriosis, uterine fibroids, like stuff now some could say, well, we just diagnose it better. I don't know, maybe, but I also know that we're doing it wrong. We're living life wrong.
For sure. And that I want to go back to talking about the pharmaceutical companies and like the different the government collusion with some of those companies. So something we didn't bring up earlier is that Teresa obviously works in the hormone field. So she prescribes bioidentical hormones. So they're more of an all natural hormone that she prescribes for her patients. Yeah. And every few years, legislation comes around. And one year it's going to be thyroid. The next year it's going to be, testosterone. There's some sort of a new legislation where they're attacking the compound pharmacies. They're attacking certain medications that are compounded. They're coming around and attacking. And then we have to fight really hard and get it shut down. Most of you probably don't hear about this. This is more of a provider level kind of thing, because then we're like, oh crap, like what are we going to do now if they're going to take away Armour thyroid? Or,
You said we're moving to Uruguay.
Was it Uruguay?
Or something like that.
I don't know if I ever said Uruguay.
Okay.
But anyway, it sounds cool, but we'll visit it sometime.
Well, and the thing is the last time that it happened was the worst I'd ever seen it. Like MedQuest, the pharmacy I used, the owner went and rented an apartment in DC to just try and help, blah, blah. But then COVID hit, and boy, they got their jollies off COVID, and it really kept them occupied for quite a while.
Yeah, for sure.
So I just think there's so much talk now about hormones. And I did see something, I think it was the Fortune magazine, that said Gen Xers, which we are not taking no for an answer when it comes to hormones. Yeah. And then if you watch that talk I did in the community a couple of weeks ago, Dr. Mary Claire Haver, who wrote The New Menopause, and Naomi Watts, the actress, wrote a book also. They were both on Oprah. Yes. So there is a lot of attention. And I think in my little brain, but I'm also a little brain, like I don't see this big pharma picture that elites do. I kind of think this is going to become a little bit less touchable, hopefully.
Yeah, women's health is starting to become more towards the forefront, as it should. Women have been, minimalized and marginalized for too long. We were just talking about that the other day with the pain medication.
Oh,
we mentioned that. You might even want to bring that up really quick, but yeah. And then hormones, obviously, what Teresa was just mentioning, that's becoming a lot more mainstream. So that's all really good news. At least it seems like it on the surface. Yes, so
hopefully it is. Yeah, women just don't get offered pain medicine. You go to the GYN and you get an IUD. They dilate your cervix, not to a 10 like you're going to deliver a baby, but they dilate your cervix and put an IUD in. They do colposcopies. They do endometrial biopsies with nothing. A guy goes in and they're going to get pain medicine for the littlest toenail thing.
Yeah.
But their rationale is women give birth. They have babies, so they're strong. They have high pain. I remember when I had the kidney stone and you were talking to one of our patients and you're like, man, her pain tolerance still doesn't mean don't offer me something.
Right. Yeah.
But we got started on this because rarely, never and always, stay away. I rarely comment on Facebook, but I'm in a couple statin groups and somebody came on and said, I stopped my statin and a month later I had a heart attack. So now I'm really upset. I feel guilty because I stopped my statin. So I went on and I said, I am 100% sure. So, it's hard to say you're 100% sure, but I am 100% sure that your heart attack did not come from stopping your statins 30 days ago. Your heart attack came from years and years and years of neglect. And a patient, I've seen a couple for, I don't know, probably since 2016. And one time, one of their family members started keto in like the summer of one year. And by October or November, the guy had a heart attack. So they said it was totally keto. Again, I can 100% guarantee you did not go on saturated fat for 3 months and get a heart attack. Yeah. You just don't. So then I was, I circle a lot of places and a lot of groups on Facebook, but they say like, when you get cancer at 50, you didn't just get cancer at 50. Cancer started at 30. Mm-hmm. And there's a great docuseries called Truth About Cancer back in 2015. Yeah. You can find it on YouTube. I think there's 6 or 7 parts. Yes. But what they do is when you get cancer, they bully you in the office and they say you have to make a decision today want to start chemo tomorrow.
Yeah.
And they act like you're going to die. They don't know when you're going to die, and they don't know that you're going to die from the cancer. But they want you to make split-second decisions when it's super important. But again, cancer has been brewing for about 20 years, and there is a peer-reviewed study I saw that ivermectin and fenbin work for cancer, which just goes, which we have thought for a long time that it's probably more fungal, parasitic stuff, cancer. But anyway,
not medical advice, just let you guys know that's our belief that this is the way that ivermectin and what was it,
fenbin and menbin,
that they work together and help with cancer. So
and then heart disease that you get at 60, it started at 25 or 30, because Lord knows we didn't know what we were doing at 25 or 30. You're eating Pop-Tarts and
I know what we were doing. We were eating low fat. We were eating a ton of carbohydrates and low fat. We were going to the Entenmann's outlet and getting these big toaster pastry things in the white carton that were, they were, all they were was pure sugar, but they were low fat. And it said it right on the box, low fat. It won't affect your cholesterol. We're like, this is great. I could go eat a whole one. And I did, for crying out loud, because you don't eat a slice of it.
It was damaged cartons. So the Entenmann's outlet, and they had a line there on Saturday mornings.
Oh my gosh. Yes. Saturdays we would go in the morning time. At the end of the week, they got all their big shipment of all the dented cartons that came from the grocery stores. And we would go in and snatch those up.
Oh, I repent, Lord. I repent. But anyway, the Alzheimer's that starts at 70 started at 50.
Yeah.
The frailty that gets women, especially because men naturally have more muscle than us. Okay. We already are more frail than them muscle wise, but frailty that comes at 80 and gets you in a nursing home really started at 40. So if you're in your mid 40s right now and health is not your number one priority, your 50s and 60s are going to suck, and they're going to be full of regret, because I saw it a lot in the hospital when I was younger, and I didn't pay attention then because I was young. But these people I always tell my patients, this is the best time to get healthy, because otherwise you're digging out of a grave. And we all know climbing a mountain is hard. Okay. Yeah. So if that elevation was a little more tolerable to get to health, that would be way easier than just trying to go climb Mount Everest in shorts with a heavy backpack and not training. Like, now is the time.
Yeah, we also hear a lot of times the excuse about, changing up the way that they're eating and getting into more of the health routines is too expensive. And I get it. Everything's expensive now because our dollars are almost worthless. Yeah. Inflation is just crushing us. But with that being said, if you think it's expensive now to go out and buy some meats and some dairy and some vegetables and stuff like that, and to join a gym or to start working out and taking care of yourself, wait till you see how expensive it is when you're 60, 70, 80 years old, hopefully, God willing, you're trying to fight against all of these things that you've been doing all your life. Then it gets really expensive.
I say this all the time to patients, and I've said it on here before. We have boys. Okay, so boys don't take care of the parents. It's daughter-in-laws and daughters. So I have told my boys many times, if I got hit by a bus, please help your dad take care of me, and I'm paralyzed or something. But if I'm 80 and I did this to myself, it is not your responsibility to take care of me. If you have time and you like me enough, fine. But when we get, first of all, we had our kids late. Second of all, when people are dealing with aging parents, they're smack dab in the middle of raising their kids, or they actually have grandkids that they're helping with now. So it's never a good time. But I'm just saying, we don't want to do that. I just had a new patient, and she was saying her mom, like Alzheimer's, and had her leg amputated because she's got diabetes out of control. She's like, I don't want my kids to have to deal with this. And that's what we're talking about. Yeah,
that and people who are smokers, they know better and they smoke their whole life and they end up with COPD, chronic bronchitis, and they just have a horrible time in their later years. Yeah. And I'm not taking anything away. We're not being non-compassionate towards those people.
Absolutely not.
So don't
both
take
our
that
dads
away.
died that way.
Both of our fathers both died from that. But it was very challenging for us to try and help them later on in life, because we were in that season of our life where we're trying to raise kids, we're running a business, we're doing all these things. And then we're also having to take care of the folks when we really shouldn't have been having to take care of the folks because they made poor lifestyle choices.
Right.
We did, of course, but it's not easy.
No, it's not easy.
Yeah.
So with all that bad news, what can you do?
Right. What can you do?
So movement, getting out, walking,
Yes.
moving your body, getting it, making sure that you can get from a seated position to a standing position
Yes.
without using your arms.
In and out of your car too.
Mhm.
Yeah, that's a big deal. And
Yep.
obviously, if you have a mechanical issue, like
Sure.
injury or something like that, where you're disabled
not
in some way,
talking
we're
about
not
you.
talking about that. We're talking about lack of muscle strength,
Yes.
which means lack of lean muscle, and we're talking about weight. So having too much fat stored on your body and creating all that extra weight.
Yep.
The good news is you can take the weight down or the fat down, and you can bring the muscle and the strength
Yes.
up. And then you're right in the middle, and you're right where you want to be.
Yep.
So talk a little bit more about what you've been doing about that. It's kind of cool about your weighted vest.
Yeah, so I've been wearing the weighted vest. You guys see me, and 2 nights now, which now I'm sitting because I did flare up my torn labrum in my hip, but I walked, and I felt so proud of myself. I said to Nate last night, guess what I did? He said, what? And I was like, I walked the entire neighborhood. And he's like, and I was like, with my weighted vest. And he was like, because he's 18 or soon to be 18, so they don't care. But I walked 2 nights in a row, the whole neighborhood, which is not huge, in my weighted vest, and my legs and my booty were sore. But all of that, but I noticed Mark has a littler car, and now I can get in and out of his car without having to push on the seat to get up, which he likes because he likes his car.
Should I not like my car? It's a nice car.
Sure.
Yeah.
And then, but now I can get up and down out of the couch easier. So these are the things you're striving for.
Yeah.
Working out. So go watch our videos. We have a free weight video, we have a band video, and we have a gym machine video, all within the last month.
And you only have to do those workouts that we show you 15 minutes per workout twice a week. That's all it takes. No excuse for not having enough time.
Yep. And I just am, and I started in February back. I had probably taken 5 years off because of my back and hip. And I told you a couple of weeks ago, I was like, I don't know how to explain this, but my legs just feel stronger holding me. I'm stronger going up and down the stairs. I'm stronger lifting the cast iron pans around the stove. It's just, it's a big difference. So movement, lean mass, and food. Get rid of the sugar. And sugar, not just Milky Way, king size. That's my favorite. Carbohydrates.
So what do we do? Specifically, I'll just tell you really quick what I do for to maintain health, so I don't have to hopefully go to a nursing home when I'm in my 60s, is I work out doing the resistance training we just talked about twice a week. So a couple of days a week we go there. Actually, the driving takes longer than the actual workout does to and from the gym. So we do machines twice a week, and I do the smart workout or the time under tension workout. I walk 1 day a week. So I try to go to especially this time of year when the weather's so nice, I'll go to the park. But anyway, at the end of the day, I walk about 5 miles. It takes me a little over an hour. And then my other day, 1 day also a week, I run sprints. So I go out on my roads here in the local neighborhood, and I just take off and I run sprints. So those are my only 4 days a week I work out. I have 3 days off. And that's what I do to maintain lean muscle, to keep my body fat low. And of course, we're eating low carb as well. So actually ketovore, or mostly carnivore.
Yep.
So that's what I do. And I can do that fasted as well. It doesn't bother me any now. I can go run sprints when I haven't eaten for 24 hours, and it does not faze me in the least.
Yeah.
So once you have conditioned your body and you get there, it's awesome.
Yeah. Do it now. Make some changes.
Make
Don't
changes.
dig yourself out of a grave. It's way harder.
For
It
sure.
is way harder.
It is. Yeah. All right. Well, did you have anything else you wanted to cover?
No,
All
we
right.
just love you guys, and we truly care about you. And we hope that this just helps somebody, because we've been on the other side where you are right now trying to get started. We've been there.
Yeah. Right on. And you stole the "we love you guys" line from me.
Oh, I'm
That's
so
what I have to
sorry,
say.
but I do love them. I
know,
pray for
we
you
love
guys all the time.
We do. We talk about our patients that we have.
And
We
I
talk
say,
about,
Lord, you know the people watching. Like, even my patients, I don't know all of their needs, but you do, Lord. So
we have conversations about those of you who aren't. I mean, we only know your screen names or whatever you call
It's
yourselves
true.
on YouTube and Instagram and stuff like that. I'm like, so and so said this,
Yeah.
and I'll read it to Teresa, and she's like, oh, it's so sweet. They're so supportive, and they comment all the time and stuff. So we love you guys, and so yeah. But I think we've said we love you enough. So God bless you all, and we'll see you next time. Don't forget, food matters.
Bye.
Bye, folks.